Thalassemia is a deadly disease. It leads to premature death. It's an inherited disease. You're born with it. There's no other way you can get it. Every one of us, every individual, we have 2 genes for every protein that we make. One comes from the father, the other comes from the mother. If both these genes are defective, the individual is a patient. If one of these genes are defective, doesn't matter from which one, from the father or the mother, then this person is otherwise normal but carrying the disease. When such a person with one defective gene marries another person with a defective gene, then there is a possibility of the children being born, the offspring being thalassemic, born with both defective genes. And that is indeed a very sad. Thalassemia is one of those diseases that can be easily prevented, and the simple prevention is a carrier not marrying another carrier. And this is the reason why, in order to know that you are a carrier, you have to screen your blood for the abnormal hemoglobin, the defect in hemoglobin. Once you know this, then by choosing not to marry another carrier, you can prevent the birth of a thalassemic child. There are many countries in the world where such efforts have been made, and by preventing marriage between carriers, countries like Cyprus has been able to reduce the number of thalassemic births to almost 0. Of course, it took them approximately 30 years. In Bangladesh, the situation is such that 1 in every 10 persons is a carrier. At icddr-b, we have done some work. We have screened 2,200 individuals, young adults, and our results show that it is approximately 10.9%. So that means 1 in 9 are carriers. And that's a huge number in the context of Bangladesh. And these people do not know that they are carriers and are getting married, and the result is thalassemic children are being born. The number of thalassemic patients, children, infants are increasing. It is estimated that in Bangladesh there are about 120,000, 90,000 to 120,000 patients in the country, thalassemia, and approximately, estimates vary, but 9,000 to 15,000 new thalassemia births every year.
icddr-b is the Institute for Developing Science and Health Initiatives. It was set up in 2014. How did we set it up? I got a very big prize from the French Academy of Science, the Christopher Rolf Prize. With that money, my family and I, we all decided that I was always very interested in doing things for science for Bangladesh, and so we decided, my husband and I and our children, we decided that we could use this money to set up a facility, and we named it icddr-b because it has a meaning. Also, it is like Bangladesh, my desh. And so we looked at all the things that can be done for science in this country. I'm basically a scientist, immunologist, so we found that there's so many things that are not done in the field of genetic disorders. And of those diseases, thalassemia is has the highest rate of disorders among all the genetic disorders. And then we have other diseases in small children, such as the inborn error of metabolism. There's no way you can test for it in Bangladesh until we started. Then there is hypothyroidism. A child is born with a very big hormone not present in the body, and it results in congenital disorders and growth disorders and mental disorders. So those are the things we were doing. And so if I come back to thalassemia, so thalassemia testing, we know that Bangladesh is now interested in thalassemia and bringing down thalassemia, eliminating it by 2030, 2028. But then you need facilities to do this. There are some societies that are doing it, but our interest is to test for thalassemia, create awareness among young people, especially college and university going medical students, non-medical students, and people in institutes, in banks, in other places. Nobody knows what problem thalassemia can create, and if you're married, one carrier of thalassemia is married to another carrier, there's 25% chance of thalassemia disease in the offspring. In very short, what we are doing at icddr-b.